You need to design your company to become the most timely, relevant, and urgent response to changing conditions in the world. If our company disappeared tomorrow, what problem would remain unsolved and would anyone notice? Don't just challenge competitors. I think they challenge the status quo. And I think, the idea is that you have to be relevant in a way that is unchallenged. And I think that's very, very hard for most companies to honestly answer because they think it's so obvious and it just isn't true.
Welcome, MedTech Gurus. Today, as we mentioned, we're joined by a bold and straight-talking leader who is reshaping how life sciences bring innovation to market. Holley Miller, founder and president of Gray Matter Marketing, is with us. Holley is a commercial growth strategist and healthcare category designer and the founder of Gray Matter Marketing, the first healthcare category design firm. She works with life sciences CEOs, boards, and investors to help them escape what she calls the product adoption lie, the costly belief that better products automatically win. With decades of launch experience and more than $4.5 billion in enterprise value created, Holley helps organizations design the market before they scale, aligning clinical, regulatory, and commercial teams around a narrative the market is already wired to want. Her work replaces traditional go-to-market playbooks with engineered adoption, turning launch risk into real market pull and category leadership. Known for her sharp insight and candor, Holley partners with innovators determined not just to launch products, but to change the standard of care. Hey, Holley, are you ready to be our guru today?
I am. Thank you, Tom.
We're excited to have you. So tell us something fun or interesting about yourself or your family so we can get to know you a little better.
Well, my plan was to attend law school after college, but to be honest, I wasn't super excited about that prospect. So I decided to defer for a year and I ended up in Santa Barbara, California. And I was hired by one of the first surgical robotic companies in the world. And that's the moment I fell deeply in love with this industry, and the rest is history. Yet almost 30 years later, my parents still ask me if I'm going to go to law school.
Yeah, when are you going to get that real job, right?
Exactly. A real job. Yeah.
Yeah. I love it. I love it. Yeah. And the working early stages of robotic surgery, it's become kind of ubiquitous right now. However, back in those days, robotic surgery was a heavy lift, wasn't it?
It was crazy. And it's funny now. I mean, the idea of there are no overnight successes. The, 100-pound, million-pound behemoth of Intuitive Surgical, back in the day, we were really desperate to try to get doctors and hospitals to even think about this crazy idea of a robot, in an operating room with a surgeon not even scrubbed in. I mean, it just was madness to them. And it's amazing now to see, 30 years later, Medtronic and J&J kind of finally bringing to market a soft tissue surgical robotics. So it's truly an amazing time. And now robots are being kind of reimagined for endovascular, work, ASCs. Like it's really an interesting time of new subcategories of robotics being, kind of created and grown. So I'm very excited.
Yeah, for sure. So Holley, as I mentioned, you've advised CEOs, boards, and investors across life sciences. So help us out, kind of take us back. What was the spark that ultimately led you to start Gray Matter Marketing?
I love that question. Thank you for asking. I founded Gray Matter about 20 years ago, really after seeing too many what I thought were breakthrough technologies, breakthrough products struggle to find market traction because a lot of CEOs and commercial leaders fall into the same trap. They think a better product naturally will win in the marketplace. When something is commercially available, just the market will, light bulbs will go off. They'll automatically adopt it. And that's what we call the product adoption lie. And the reality, which many companies miss, is that adoption has to be designed as intentionally as the product itself, because the innovation only matters if it's embraced by the market and it advances the standard of care, right? The most successful companies aren't actually trying to get people to buy their product or use their product. They're really getting people to change their belief and behavior. And with so many urgent, unsolved problems in healthcare, we frankly can't afford to have breakthrough innovation die on the vine, right? So designing adoption isn't optional. It's really how progress happens. And so that's the genesis of gray matter.
Oh, yeah, I like that. And you mentioned the product adoption lie, right? And you coined that term. So take us a little deeper into that. What is it? And really, why does it derail so many healthcare launches out there?
I think to put it, in the simplest terms, the product adoption lie is the belief that if a product is better, the market will, adopt it. As simple as that. But what I've seen time and time again is that this simply isn't how healthcare markets work. The miss is really understanding how powerful the status quo is, even when something superior exists. And so the fastest and frankly, the only way to scale adoption is again to get people to think differently and act differently. And what that entails is getting them to reject what they're currently doing and embrace something new. And again, that rarely happens automatically. It has to be, intentionally designed. And this derails launches because companies often mistake being ready internally with this external market readiness. Like it's just so obvious, right? And so internally, belief is high. You've got strong data. You've got your regulatory milestones. You've got a seasoned sales team. But externally, the market is still anchored in the old way of thinking. And, they've been living with whatever problem it is for years. They kind of accept it, right? They just learn to tolerate it. They accept it as that's showbiz, if you will. And so what happens then? Companies think, well, we'll hire more sales reps. We'll have, better messaging. We'll offer discounts. But the execution can't fix that kind of belief gap, if you want to think about it that way. And so when you look at the statistics, it's pretty grim. 2 out of 3 healthcare product launches fail to hit projections, and they honestly never catch up. And it's because the market never made that mental shift required to adopt something new. And I think that's just this kind of myth that has been pervasive in the medtech space. There's a research report that says it takes 17 years for something new to really become, the standard of care. And so you're just really launching to such inertia and resistance.
Yeah, and I might thank you for that, and I might put you on the spot just a little bit. Do you think some of that is because, well, first of all, we're so protocol driven in the healthcare space, right? We've got all that, and it's not just the clinician that has to change; it's a lot of the behind the scenes people, right? From everything from patient intake to some of the support staff, other clinicians. So is that part of it? They're thinking about that end user, that surgeon, that respiratory therapist, or that anesthesiologist, but they've not thought through all the other steps.
That's a incredibly astute observation and insight, because I think to your point, oftentimes companies solve for that one dimension, right? It's one person, one problem, but they're not understanding that whole clinical workflow. And so many, many examples I could point out where, there's a new instrument in the OR that a rep wants a surgeon to try. But guess what? The surgeon scrubbed in. He goes to do the procedure, and magically, strangely, the instrument is not, sterile and on the table. And so guess what happens? The surgeon just goes about the surgery. He's not going to stop and be like, where's that new instrument?
Right.
And so you've got to get the scrub nurse. You've got to get, inventory management. Like everyone has to some degree, buy in. We talked at the beginning about robotics. That was a real issue because it took an extra 45 minutes to set up the OR to use robotics. Nurses didn't like that. People didn't like that. Administration didn't like that. It was really kind of, hampering this idea of efficiencies. So the solution has to solve a problem big enough that you get all of those key stakeholders on board to get them all rowing in the same direction and, embracing the idea altogether.
Yeah, and then you got to get those folks trained too, right?
Got to get them trained too. Absolutely.
Yeah.
Absolutely.
So, and then you touched on this, right? That 2 of the 3 healthcare launches fail, right? Which is pretty staggering when you think about it, and humbling, right? So let's dive a little deeper into that. What are you seeing are some of the most common mistakes that companies are making? Can you give us some specifics there?
I think there are kind of 3 big ones, just off the top of my head. I think first, teams confuse internal progress with this external market readiness. They're clearing the regulatory hurdles. They've got the manufacturing partner nailed down. They've got a strong sales plan. So operationally, everything looks on track, right? It looks strong. But they haven't stopped to really pressure test their assumptions about how the market really thinks. So they may not ask the uncomfortable questions like, why would someone stop doing what they're doing today? Like what has to change? What belief has to change for that to happen? So again, kind of internal progress versus external readiness. The second, companies focus on solving a problem the market doesn't really believe is clinically meaningful. So the problem might be real, but the audience experiences the solution as more of a nice to have, not a must have. And so that kind of, without that urgency for a specific audience, not everyone, but for a specific audience, people basically just maintain what they're currently doing, right? They just keep going on with that standard protocol that they're accustomed to because it's kind of working, right? It's kind of working for them. And third, I think there's often no meaningful difference compared to what's already available. I always say people don't buy what you make, they buy what you make happen. So they're largely indifferent to the tool. If I need to put a hole on my wall, do I use a hammer or do I use a screw? A drill. The idea is I just need the hole. So if they can get the same outcome another way, then your product becomes interchangeable. When those three things are true, companies tend to see what I call anemic adoption. You might get initial pop, you might get a little bit of traction, but you don't get that sustained growth because the market does not view you as a must-have. And they're going to default to whatever the status quo is, whatever they're comfortable doing. And I think that's why leadership, when they recognize what has happened, those kind of misses pre-launch, it becomes very difficult and very expensive to fix. And most companies, frankly, can't turn it around.
Yeah. Do you think some of that, and I'm just, thinking out loud here, but is some of that because the FDA authorization process is so different than the launch process, right? I mean, you're doing clinical research studies to prove the efficacy, but then when you launch, you often have to do kind of value-based studies to show how this really worked. Is that part of the disconnect, do you think?
It's a great question. And I don't know if it's a true black and white, answer. I always say, the strongest companies, I think, recognize what's missing in the market and they fix it. So they go in with a preconceived, idea of like, here's the problem, here's how we fix it, let's go build it. A lot of companies tend to say, we have this technology we've invented, how can we use it? And I think that's where things get tricky because then you're kind of, I don't want to say painting yourself into a corner, but you have self-imposed constraints that make it difficult. And I think then you're a little bit trying to make, put the bow on it. And you may have very well, undermined your own capacity to truly commercialize a product that's going to matter. We spend a lot of times with startups and investors who consult with us. And the number of CEOs and often co-founders that come to us and say, well, we're going to be a class 1 device. It's the fastest, cheapest pathway to regulatory approval. But the problem is you can't say anything. You can make no claims. It's just, right. Hey, I have a red pen, this red pen saves your life or this red pen reduces your cholesterol, whatever it is. And they miss the point of it isn't about speed to market if no one is going to adopt your product. And so I think some real foundational, almost like Achilles heels, decisions are made too early. And if they would really kind of stop at the very beginning and pause and say, what's the problem? What's the value of solving it? Who cares the most? That will be a much more successful company, even if it's a premium product. Like it isn't just, going back to robotics, it's even 20 years later, it's an extra $2,500 minimum per case. And there's really not been a clinical study that shows it's superior to laparoscopy. That's just how it is. And there are a lot of things like that.
Yeah. Yeah, that's really helpful, and thank you for that. And when I was doing my research, Holley, if I've got this right, I think the quote is, don't go to market make the market come to you, which I really liked because I come from the sales arena. So that really resonated with me. But, a lot of our gurus out there are early stage or want to be soon to be entrepreneurs. So what does that really mean in practice? Can you help us understand that?
Sure. So I think, go to market's a term most of us have heard, right? And I think it becomes the default commercial strategy in healthcare for good reason, because it's how companies translate product and execution, right? That's a very logical way to think about it. But the hidden assumption behind go to market strategies is that adoption is automatic. Again, that once you show up with something better, the market will just naturally embrace it. And what I'm challenging is that belief. Adoption isn't automatic, it has to be designed. And so by making the market come to you means that you're doing the work before execution to literally rewire how the audience thinks about the problem they're tolerating. What's the risk of staying where they are and why the old way no longer makes sense? I recognize that you cannot promote the product before regulatory approval, like that's well established, but you can promote the problem you're solving. And so we call that problem marketing, not product marketing, but the market has to see and feel that pain and believe change is necessary. So when you're ready to sell, they're already ready to act. And so that's why we say it's not about going to market. It's literally about kind of pulling the market towards you. And that is where you don't have to fight resistance when you're doing your commercial execution. You're really starting to feel like it's just inevitable. People are nodding their heads when you say, hey, I've got this thing. Do you experience this problem? The doctor's nodding their head. You're like, great. If I could solve it for you, wouldn't that be amazing? They're like, yes. And then you say, well, hey, lo and behold, I have the only product that can do that. And so you really become the only logical solution, not just another option in the mix.
Yeah, got it. And that really kind of leads into my next question too, because gray matter marketing is the first healthcare category design firm, which I really liked. But I think I understand that concept, but maybe you can help us. How does category design differ from traditional branding or positioning?
Thank you for asking that. I think when most people hear category design, they assume it is just, branding or positioning with, a new label, a marketing term that someone in marketing invented to sound unique and different. It's honestly a business discipline. It's a company, mindset, a company lens, not just one department. And I would say that traditional branding and positioning are about competing, right? You're competing, you're trying to be better in an existing market. You're trying to be incrementally better and then, asking the sales team to, push harder. Category design, though, is about changing how the market defines a problem and what the new standard should be. So I think about it as creating a new space in the audience minds that makes you the only choice. And so, for instance, if you need a transportation vehicle, that's what a car is, right? It's trying to take you one place to another. There are different categories. You could choose a pickup truck, you could choose an electric vehicle, you could choose a sports car. Depending on what your need is would dictate the category that you choose. And so if I live on a farm, I might need a pickup truck. If I'm commuting in the Bay Area where I live, you could spend 2 hours or 3 hours in a car every day and gas is high. So maybe an electric vehicle is what I want. And so it's this idea of trying to create a new space in the audience's mind that you become the only option. And why this matters is because markets reward the company that defines the category. So in most industries, even, especially healthcare, the category creator captures the majority of the long-term market value and everyone else kind of competes. So if you think about, again, surgical robotics, Intuitive has been on the market for 30 years. They own 98% of the market economics of surgical robotics. Now there's competition coming, but they're really the dominating factor. And I think, life sciences teams often miss that. They say, okay, well, we need to grow revenue. Let's add sales reps versus saying, how do we essentially teach the market that we are the only option available that makes us irreplaceable, right? You're not going to be able to go out and get someone else to do the same task or the same product, the same task. And so when you design the category, selling gets easier because you're no longer arguing about, hey, like we're better, we can do 2 degrees, 5 degrees, 10% cheaper, whatever it is. The market believes that you are the obvious choice, and you're essentially owning a space in their mind that translates to the physical, financial, kind of share on the market. Mm-hmm. So definitely not branding, definitely not positioning. It's really a business strategy to be irreplaceable and make competition irrelevant.
Yeah, that makes a lot of sense. But to back up just a half step with that, right? Earlier on, we were talking about, aligning some of the internal components of this, the clinical, the regulatory, the commercial teams, in how do we strategize, engineering that adoption. So how do you get to that, single narrative that actually drives the uptake? It sounds like you're herding a lot of cats in here and getting people to think differently.
It's so true. And we always say that's the operative word. It's different, not better, not faster, not cheaper, not whatever. Mm-hmm. It's, you want to be different. And it is one of the hardest things. I love that you use the analogy herding cats. When life sciences companies think about bringing a product to market, it's an incredibly data-driven industry, right? I mean, whether it's the product tech, the clinical data, the design studies, like everything is highly data-driven. And we are trained to believe that if the data is strong enough, adoption will follow. Just, and end of the story. The truth is, the data doesn't create the belief, it validates it. So it doesn't matter if you are a rocket scientist, a brain surgeon, or a teenager. We make decisions emotionally first, then we validate that with data and rational information. So when you think about engineering adoption, you really have to get belief internally and alignment internally, and then translate that externally. And when teams are leading with this proof, how big is the TAM? Look at our clinical study data. Look at the endpoints. They skip this idea. They skip this step of making the audience feel that pain, feel the inevitability that we've got to change. And so leadership needs clarity on what do we need the market to believe, or how do we change their thinking to get them to basically say, we can't stand for this anymore. And when that kind of POV, that line of thinking of here's the problem, here's the problem, here's who has it, here's how your life is going to radically change for the best when you do this. And all of the energy goes to support that from the company, then everything lines up internally. You get the clinical teams focusing on generating the evidence that proves that this works. You get your regulatory team focusing on what can we claim, right? How do we get this approved? You have your commercial team that's focusing on turning belief into behavior in the market. And when all of those, commercial departments come together around this kind of problem and solution, then it becomes internal momentum that translates to external momentum. One of the most common feedback we get from CEOs when we work with them is, I didn't realize how hard it was to get the company aligned, and I didn't realize how misaligned we were. And I think that once they step back and kind of agree on the problem, the solution, et cetera, they start to see a much bigger story. And it's no longer about a product. It's really about, we're going to change the world and put a dent on it and, really evolve the healthcare landscape. And I think that's what allows companies to really get excited, come together, and make sure they're deploying their resources, both the human capital and the financial capital, around this idea of creating truly a new paradigm in the healthcare space.
Yeah, thank you for that. But I was listening to that. It was fascination. And I'm thinking the first thing is, it sounds like it takes an awful lot of communication. And it sounds like you're spending a lot of time breaking down silos. Am I heading down the right track with that?
You are. And I always say the the CEO in our world is the chief evangelist officer. That's actually their job. They have to be a rebel with a cause, and they have to essentially create a rallying cry to get all of those departments, to come together to rally around that mission. And we think about it as, these executives are missionaries, not mercenaries. They're really trying to change the world, and that's not unusual. But I think what is important to kind of create that synergy and alignment around is how you do it. The idea with category design, it's the most efficient and most effective way to accelerate adoption and accelerate valuation, like full stop. And so I think once people realize they all have such an important role in that, things shift. But it is a lot of kind of, resistance, some posturing. And once it all gets broken down and kind of gets built back up, it's transformative, and you sense it just, on a visceral level.
Yeah, yeah, that's so helpful. And, without naming names perhaps, but examples are always helpful, right? So I'm wondering if you've got a practical example about how, designing the category and not just the product, helped a company accelerate adoption or create a competitive separation. Do you have a story for us there?
Absolutely. And I agree. Like, it's always nice to have a tangible, kind of example to look at. A recent one I'll highlight is Shockwave Medical. What they did differently, they didn't just build a better device. They truly changed how the market understood the problem. So instead of competing against stents or arthrectomy tools, they reframed the problem. They said severe arterial calcium is its own disease state. It's not just a frustrating part of the procedure that we have to deal with, which was kind of, the mentality. And so that shift is saying this is its own disease state. Once clinicians saw that calcification was the root problem, then the old tools kind of looked inadequate, right? They didn't say like, hey, we're better, we're cheaper. They made the intravascular lithotripsy, IVL, they made that feel like the only safe and predictable way to address this clinical problem, which kind of people just thought was part of that's just how it is with these patients. And then they used the clinical evidence the right way. They didn't lead with it. They weren't trying to convince skeptics from scratch, but they reinforced belief that was already forming. So they took their early adopters and they helped them become educators and activators. So their peers, right, were telling their colleagues about this idea of like, hey, aha, light bulb went off. There's actually a separate condition we have to treat first before we move on with the primary procedure. And so education is what helped kind of create this conviction. And then you had not the company, advertising and doing campaigns. It was the clinicians essentially saying, we got to change, right? We've got to change. And so IVL started being seen as the necessary step of treating calcified lesions. And that's really category design at work. And when that happens, adoption starts to accelerate, competition becomes irrelevant, and enterprise value follows. And so in 2024, J&J acquired Shockwave for, I think, like over $13 billion. And so they could have easily come to market and said, we're better, you should use us, we're faster, cheaper, whatever. And they said, no, we're going to teach the market that there's a different problem that's worth solving. And they created that belief that then translated to change in behavior.
Yeah, yeah, that's outstanding, and that's what a great success story as well.
Yeah.
That
Happened overnight. I'm just kidding. Of course.
Yeah, of course, right?
Like,
Yeah, right.
12 years. It took
Yeah,
12
right.
years.
Yeah, right. A lot of heavy lifting, to be sure. So, but I want to just shift the conversation a little bit too, because I know you work with investors, and again, a lot of our gurus out there are early stage companies, and finding that investor and getting them involved with you in helping you is very, very difficult, as we all know. But you've said, your team has said, investors don't fund products, which I loved. They fund new categories. So what should we be thinking, out to understand how investors evaluate this commercial risk and how your team can help mitigate that?
Thank you for that. And I do agree. The landscape, the headwinds for raising money has been quite challenging, and we've seen a lot of shifts happening with sovereign wealth funds and family offices. And I think what's become clearer and clearer for companies, especially, is you want to get the right investment partner. And I think part of that is finding people that believe this kind of category design mindset, which is investors are funding companies that are different, and they're betting on your ability to create a new market you can own and dominate. So I think venture capital, to me, in its highest form, isn't about optimizing margins or eking out efficiency gains in a crowded space. It's really about building something net new, something that expands what the market believes is possible. And when a company shows up as better, I think investors see a capped opportunity. You're really fighting for share in an existing market, and execution then becomes the primary lever you have. But when a company shows up as different, again, my favorite word, different, it's creating a new place really in the mind to claim. I think the opportunity changes, and I think the right investors at that point, they're trying to help you create value that didn't exist before. And so that's why these category creating companies attract a disproportionate amount of capital and command disproportionate valuations, because they're looking at it through a different lens. And I think just the news hit today that Penumbra got acquired for, again, like billions of dollars. And it was the same type of thing. They were showing a different way, and companies recognize this is the future. And that's, $1 billion sign, not $1 million sign.
Mm-hmm. Yeah, that's very helpful, and thank you. In this process, right, when you're going through this with organizations, leaders have egos, CEOs have egos, investors certainly do, right? You've got all this going on with some very type A personalities, so one has to be candid when you're trying to do these types of changes. So, help us out with. Is there like a hardest truth, or you have an example of really having to give somebody some really tough feedback about why their product isn't getting traction? Do you have a story for us there?
Yeah, and I love that question because it's like their baby, right? Like everyone thinks their baby is beautiful, right?
Right.
And I think it's hard to say, like, maybe your baby is the most beautiful baby. And so I think the one of the hardest truths that we often find ourselves kind of having to say perhaps is, maybe your product's just a nice to have, like, in the market today, as it exists today. And until that changes, your revenue is going to it's going to be unreliable. You're not going to have sustained growth. And, that usually shows up in a couple ways. One, they see a huge TAM and they think we're going to go after the whole market. The opportunity is huge. But if you're for everyone, you're for no one, right? So I think helping them find that most strategic beachhead is really key. And then if you dominate that, you can get bigger. So it's a nice to have if you go after everybody, but if you find the right, niche, then you become a must have. And that's the ultimate goal. I think the other kind of harsh truth is that they think they're solving an important problem, but the buyers don't frankly care about it. Like, it might be a real problem, but it's not urgent. And so it's that in of itself is not enough to drive behavior change. And there have been companies we've just flat out said we can't work with you because, like, we cannot, make this something it isn't. Like, you're literally just being an incrementally better product, and no one cares, if your shoelaces are orange versus white. Like, it doesn't really have any material impact. And so none of that means the product is wrong. I think it just means that the product hasn't been framed as a kind of must-fix problem for a specific audience. And then once that shifts, the market sees that this is necessary. It's not optional. Like, everything changes. Adoption speeds up. It gets easier to sell. But every company we've worked with has had to change really kind of who they go after, what the problem is, because they just end up thinking that their baby's beautiful when in truth it's not.
Yeah. And I would think that the earlier you can get involved with a technology in a company, the better, right? Because if they get too far down this pathway, backing up is timely, expensive, or time consuming, expensive, and pretty painful, right?
Incredibly so. And to your point, we made an intentional change a couple years ago to say, like, hey, to your point, let's work with companies before launch because it's just too expensive and too hard to flip that switch once you've made those kind of, you know, uh, deadly sins, and you can't turn around in a quarter. And if you're a public company, like, you're going to get hammered. And so even if you're a private company, like, you just don't have the runway. And so that's what we're really on a mission to do, is to try to teach companies before they launch, ideally 12 to 24 months, like, hey, let's talk about some of these key, almost like springboard decisions you're going to make that are going to completely, dictate your trajectory. And ideally, you start from day one when you're like, hey, I found this problem. I think if we saved it, solved it, would be amazing. But many companies, to your point, they're on the path, they think that they're doing, and then they launch and they realize, oh, we're excited, but the market's not excited. And all those exciting projections we made for revenue, we're not going to hit them. And then we have hard questions to answer to the board and the investors. And it's very hard to flip that switch.
Yeah, yeah, for sure. So, Holley, this has been very helpful. If you could give one piece of advice for our listeners, right, our MedTech innovators out there, trying to build enduring companies, not just launch a product, what would you tell them?
This is such a great question, and it's such an important one. I think what I would say, if I had to give one piece of advice to an innovator that's playing the long game, that really wants to put a mark on the world, is you need to design your company to become the most timely, relevant, and urgent response to changing conditions in the world. And that sounds like a very lofty thing. But what I'm trying to say is, if our company disappeared tomorrow, what problem would remain unsolved, and would anyone notice? If you pull the plug, would people, literally revolt in the hospital or patients because the thing that you served them, no longer is available? Or they just kind of shrug and say, well, okay, I'll just go on to the next thing. And we've worked with companies that literally their customers just say, if this was taken away, like, I would quit. I would pick it outside. And that's the kind of feeling you want. So enduring companies don't just challenge competitors. I think they challenge the status quo. And I think, the idea is that you have to be relevant in a way that is unchallenged. And I think that's very, very hard for most companies to honestly answer because they think it's so obvious, and it just isn't true. And it's not set it, forget it. It's not, we did this one product and we're done. It's this constant change. Think about right now, the new healthcare economy. You have consolidating hospitals. You have reduced access. You have, tariffs that are affecting supply chains. You have, reimbursement changing. You have all of these things going on. And those can really constrain companies, but they also open up amazing doors and amazing opportunities for companies to actually say, we can fix that. And that's where people become, you just become irreplaceable. They'll fight for you, which is what you want.
Yeah. Yeah, I love that. And very good example there. So, Holley, first of all, thank you, for your time to be our guru today and some of the insights you brought. But this sounds like a very exciting time at Gray Matter Marketing. So, what's the future hold? Where are you going from here?
My goal is to help as many companies make their product, this new standard of care. That would make me happy. That's what gets me out of bed in the morning. And so for us, I think our shift is just trying to help as many companies before they get to the market and they really kind of can't, it's expensive and hard to change. And so when I think about making a dent on the world, our tagline is do what matters. To me, I want to do what matters to patients, to physicians, to our customers, to investors. And that's really our North Star. Do what matters. And it sounds like a very maybe simple way to think about it. But that's really what I think we could all kind of think about in that context of, is what we're doing helping us achieve that. And so for Gray Matter, it's just really aligning our North Star with companies that recognize it's too important for these innovations not to make it to market because we've got some major, big, complex problems to solve. And so we just want to keep working with companies that are committed to that mission.
Yeah, that sounds really challenging, but very exciting. And I can feel the passion and energy. So I love that.
Well, I started working first in an advertising agency, and my first client was a big tobacco. So I sold cigarettes, which is not exciting and not very compelling. And so this is the other end of the spectrum. And it's something I've really come to love. And, our mission is to help as many companies as we can. We have some great resources and tools that we'd love to make available, to the listeners. We have a new newsletter we're launching, which is really all about how do you avoid these landmines and don't fall prey to the product adoption lie. And some are diagnostics to help you figure out where you are. Some are, to do before you even, step on the landmine. So would love to connect with people. We've created a dedicated landing page for your listeners. It's graymattermarketing.com. and then /guru pod. So we would love people to go visit that. Maybe you can put that in the show notes and they can have access to all these resources.
Yeah, that's fantastic. And then, thank you for that. And we'll be sure to direct folks there. But how else can we find out more? Is there a website as well? Is there a LinkedIn?
Please search me on LinkedIn. I always love to meet like-minded people and, bounce ideas off of people, be a sounding board. So connect with me on LinkedIn. It's Holley, Holley, which is my mother's maiden name, which is why it's spelled weird. So it's Holley, Holley Miller. And then our website is Gray Matter Marketing, GREY, graymattermarketing.com. And you can learn all about the product adoption lie. You can access these tools. I mentioned we have a dedicated landing page for your listeners. And then we have a new monthly executive briefing that we're offering called the Launch Code, which is really, again, tackling launch risk, how to accelerate market traction and navigate growth pressure. So we're very excited for 2026 and I hope it's going to be a great year for all.
Yeah, that's fantastic. So, Holley, once again, thank you for the time and information and the insights that you brought to us as our guru today.
Well, thank you so much again. Such a pleasure to talk with you and experience this great conversation with you.
Oh, thank you so much.
Thank you. Thank you for listening to MedTech Gurus. I am Sylvester Harris, your MC. If you want to learn more about Tom and his consulting services, you can go to www.pctmedical.com or email Tom at tom@pctmedical.com. Now, I can be reached at Sylvester Harris, that's SylvesterHarris 5048@gmail.com. And I'd be pleased to discuss any voiceover work that you may want for your company or broadcast. Hey, thanks so much for listening and catch us on the next episode of MedTech Gurus.